What's up, everybody? It's Brett here at Progressive Mobility, Physio, and Performance here in Spartanburg, South Carolina. Today we're going to continue our National Athletic Training Month videos as it is the month of March, and we're going to share the NATA's recent poster that they put out in the monthly magazine and talk about some of the injuries and the variety of things that athletic trainers can help with in a variety of different settings. So we'll start here at the top. Concussions. Athletic trainers provide a safer return to work, life, and sport following a concussion. There's been lots of research regarding concussions, and then there's been a lot of social media attention regarding concussions in the NFL and in other professional sports worldwide. Athletic trainers are at the forefront for diagnosis and management of those injuries. Next, we have asthma and diabetes, some things that you may not consider athletic trainers having to have some expertise in, but particularly in middle school, high school, collegiate sports, and professional sports, and also with tactical and performing arts, being able to screen athletes for asthma and diabetes and different subsets of those things and what those things entail is very important. Sudden cardiac arrest. Cardiac arrest is the #1 cause of death in sports. However, survivability is greater with an athletic trainer present. That's why athletic trainers do what they can to be present at all sporting events. That way, in the wake of some sort of emergency, we take the very infamous Damar Hamlin situation. Athletic trainers are very poised and prepared to call when the moment is ready, when the moment is there, and they are always ready. Next, we have skin disease. This is very important with wrestling in particular. We'll use wrestling here as an example, making sure that any types of skin disease that is notified and identified so they can get the proper medical inspection from a physician and proper medications. Musculoskeletal injuries. This is one of the largest things that athletic trainers spend their time on, evaluating, treating, and preventing these acute and chronic injuries from head to toe. Also, we have osteoarthritis, ACL injuries is another really important piece that athletic trainers work on in conjunction with physicians, physical therapists, other physiotherapists, and people in the sports medicine and sports performance realm. We are very well suited to be able to provide information and educate and collaborate with those regarding ACL injuries, as well as on the research front. Spinal injuries. ATs are at the forefront of best practice management and prevention of spinal injuries. Next, we have sickle cell trait. ATs are equipped with the best practice to identify and manage sickle cell trait, allowing patients to thrive in work, life, and sport. Identifying and screening for sickle cell trait is extremely important, and athletic trainers take these protocols very seriously when assessing different types of athletes before they go into whatever activities are required for life, sport, or work-related actions. And finally, we have exertional heat illness. Although exertional heat illness is one of the leading causes of death among U.S. high school athletes, it is preventable, especially when quickly recognized and managed by an athletic trainer. It's a big push in the National Athletic Training Association to get athletic trainers at every high school in the country. We're going to continue to work very diligently at that in order to make sure that high school athletes have the proper people and personnel and action plans in place to identify, mitigate, and handle any of those situations while also preventing those situations from occurring. So as you can see, from head to toe, athletic trainers can provide a wide variety of experience and expertise and help athletes and other patients in a variety of different settings to give them the highest quality of care possible. There's an AT for that is the mantra for this poster this month. And if you have more questions about athletic training, feel free to shoot me a message at Progressive Mobility _AT on Instagram. I'd love to talk more about athletic training with you. And always remember that you have, now that you are empowered with the education for athletic training, let's work together to advocate for athletic training, and not only for athletic training, but for all healthcare providers, and being able to recognize and showcase their skills and expertise. Thanks for watching. I hope you have a great rest of your day, and happy National Athletic Training Month.